Have you ever felt so thirsty that no amount of water seemed to satisfy you, or found yourself getting up 2, 3, sometimes 4 times a night just to use the bathroom, and brushed it off as nothing more than drinking too much water before bed? What if I told you that this one small, seemingly harmless pattern could actually be one of the earliest warning signs your body gives you before a diabetes diagnosis? Stick with me, because by the end of this video, you're going to know exactly what your body might be trying to tell you, and more importantly, what to do about it. Diabetes is one of those conditions that tends to creep up quietly. It doesn't usually announce itself with a dramatic event. Instead, it whispers through small changes that are easy to explain away. You tell yourself you're just tired because of work. You assume your vision is blurry because you've been staring at screens too long. You figure that cut on your foot is just healing slowly because you're getting older. And that's exactly what makes diabetes so tricky. According to the Centers for Disease Control and Prevention, more than 1 in 3 American adults have prediabetes, and the overwhelming majority of them don't even know it. That's not a small number. That's tens of millions of people walking around with elevated blood sugar, unaware that their body is sending them signals right now. So today, we're going to walk through 7 of the most important early signs of diabetes that doctors want you to know about. We'll talk about why these signs happen, what's going on inside your body when they show up, and when it's time to stop guessing and actually get your blood sugar checked. I'll also clear up a few common myths along the way, because there's a lot of misinformation out there that can either scare you unnecessarily or, worse, give you false reassurance when you shouldn't have any. Let's get into it. The first sign, and probably the most well-known, is that combination of excessive thirst and frequent urination. In medical terms, these are called polydipsia and polyuria. Here's what's actually happening. When there's too much sugar, or glucose, circulating in your bloodstream, your kidneys have to work overtime to filter it out. Normally, your kidneys reabsorb glucose back into your blood, so none of it goes to waste. But when blood sugar levels climb too high, your kidneys simply can't keep up, and the excess glucose starts spilling into your urine. That glucose pulls water along with it, which means you end up producing more urine than usual. Your body loses fluid faster than normal, which triggers intense thirst as it tries to replace what's being lost. It becomes this frustrating cycle. You drink more, you urinate more, and the thirst never really goes away. If you find yourself waking up multiple times a night to use the bathroom when that wasn't normal for you before, or if you're going through water bottles like never before and still feel parched, that's worth paying attention to. Now, I want to be fair here because there are other reasons someone might be more thirsty or urinating more frequently, including simply drinking more fluids, certain medications like diuretics, or even just hot weather. So this sign alone isn't a diagnosis. But when it shows up alongside some of the other signs we're about to cover, it becomes a much stronger signal. The second sign is persistent fatigue, and this one gets dismissed constantly because, let's be honest, almost everyone feels tired these days. But diabetes-related fatigue has a specific cause. When your cells can't get enough glucose, either because your body isn't producing enough insulin or because your cells have become resistant to the insulin you do have, your cells are essentially starving for energy, even though there's plenty of sugar floating around in your blood. Think of it like having a truck full of groceries sitting outside a locked house. The food is right there, but nobody inside can access it. That mismatch between available fuel and usable fuel is what leaves so many people with undiagnosed diabetes feeling drained, foggy, and low on energy, even after a full night's sleep. This kind of fatigue tends to be persistent, rather than something that improves with rest. If you've been sleeping enough, managing your stress reasonably well, and you're still feeling unusually exhausted day after day, that's a signal worth exploring with a healthcare provider, especially when paired with any of the other signs on this list. The third sign is blurred vision, and this one catches a lot of people off guard because they assume it's simply an eye problem that needs new glasses. High blood sugar can cause fluid to shift in and out of the lens of your eye, and this changes the lens's shape and its ability to focus properly. This is different from long-term diabetic eye damage, like diabetic retinopathy, which develops over years of poorly controlled blood sugar. This early blurriness is more of a temporary, fluctuating symptom tied directly to blood sugar swings, and interestingly, it can actually improve once blood sugar is brought back under control. That said, this doesn't mean you should ignore blurry vision and just wait for it to resolve on its own. If you notice sudden or unexplained changes in your eyesight, especially if they seem to come and go, it's worth mentioning to both an eye doctor and your primary care provider because this is one of those symptoms that connects the dots between two different specialties. The fourth sign is slow healing cuts, wounds, or frequent skin infections. This happens for a couple of interconnected reasons. High blood sugar can impair circulation over time by damaging blood vessels, which means less oxygen and fewer nutrients reach the site of an injury. On top of that, elevated glucose levels can interfere with the normal function of white blood cells, the cells responsible for fighting off infection and helping tissue repair itself. So a small cut that would normally heal within a week or two might linger for weeks, or a minor skin infection might keep recurring. Diabetes is also associated with certain skin conditions, including a higher likelihood of fungal infections, particularly in warm, moist areas of the body, because yeast and fungi tend to thrive in environments with higher sugar content. If you've noticed that cuts, scrapes, or blisters are taking noticeably longer to heal than they used to, or if you're dealing with skin infections that keep coming back, this is a pattern your doctor should know about. The fifth sign is a bit less commonly discussed, but it's incredibly important, and that's tingling, numbness, or a burning sensation in your hands or feet. This is referred to as peripheral neuropathy, and it happens because prolonged high blood sugar can damage the small blood vessels that supply nerves with oxygen and nutrients, and it can directly injure the nerves themselves over time. It typically starts in the feet before moving to the hands, sometimes described as a pins and needles feeling, or like wearing an invisible sock that isn't really there. Now here's an important nuance. Neuropathy usually develops after blood sugar has been elevated for a longer stretch of time. So when it shows up, it's often a sign that blood sugar has been high for a while, not necessarily a brand new development. This is exactly why catching diabetes earlier through the other signs we're discussing matters so much. Because catching it before nerve damage begins gives you a much better chance of preventing this particular complication altogether. If you're noticing numbness or tingling in your extremities that isn't explained by something else, like sitting in an awkward position or a pinched nerve, please don't brush it off. Nerve damage from diabetes can be slowed or even partially reversed if it's caught and managed early, but it becomes much harder to treat once it progresses. The sixth sign is unexplained weight loss, and this one tends to surprise people because we often associate diabetes, particularly type 2 diabetes, with weight gain rather than weight loss. But when blood sugar is significantly elevated and your body genuinely cannot use glucose properly for energy, it starts breaking down fat and muscle tissue as an alternative fuel source. This is more commonly seen in type 1 diabetes, where the pancreas produces little to no insulin, but it can also occur in more advanced or uncontrolled type 2 diabetes. If you notice you're losing weight without trying, without changing your diet or exercise habits, and especially if this is happening alongside increased thirst, frequent urination, or fatigue, this combination should prompt a conversation with your doctor sooner rather than later. Unexplained weight loss is one of those symptoms that should never be self-diagnosed or dismissed, because it can be a signal for several serious conditions, not just diabetes, which makes proper medical evaluation especially important. The seventh and final sign is increased hunger, medically known as polyphagia, and this often goes hand in hand with the fatigue and weight loss we just talked about. Remember that groceries outside a locked house analogy from earlier? Even though there's plenty of glucose in the bloodstream, your cells aren't able to access it properly, so your body interprets this as a state of starvation and responds by increasing hunger signals, even shortly after eating a full meal. Some people describe feeling hungry all the time, or feeling unsatisfied no matter how much they eat. This is different from typical hunger that responds normally to eating and then goes away for a few hours. If you're finding that your appetite has become unusually intense or persistent, and it doesn't seem to improve with meals the way it used to, that's worth paying attention to, particularly when it's occurring alongside fatigue or weight changes. Now, before we go further, I want to take a moment to talk about a few myths surrounding diabetes, because misinformation here can genuinely delay diagnosis or create unnecessary fear. The first myth is that eating too much sugar directly causes diabetes. This is an oversimplification. Type 2 diabetes develops from a combination of genetic predisposition, insulin resistance, body composition, activity levels, and metabolic factors. Diet plays a role, particularly diets high in refined carbohydrates, simple as sugar itself being the sole cause. Type 1 diabetes, on the other hand, is an autoimmune condition and has nothing to do with diet or lifestyle at all. The second myth is that you'll definitely know if you have diabetes because the symptoms are obvious. As we've covered today, the early signs are often subtle, easy to dismiss, and sometimes entirely absent, especially in the early stages of type 2 diabetes. This is precisely why routine screening matters, particularly for people with risk factors, rather than waiting for symptoms to appear. The third myth is that only people who are overweight get diabetes. While excess weight, particularly around the abdomen, is a significant risk factor for type 2 diabetes, plenty of people with normal body weight develop it too, especially when family history, ethnicity, age, or other metabolic factors are involved. Judging someone's risk purely on appearance is both inaccurate and unhelpful. So who should be paying closer attention to these signs and considering getting screened? The American Diabetes Association recommends that adults age 35 and older get screened for type 2 diabetes, and screening should start earlier and happen more frequently if you're overweight and have additional risk factors such as a family history of diabetes, high blood pressure, low levels of good cholesterol, elevated triglycerides, a history of gestational diabetes, polycystic ovary syndrome, or if you belong to certain higher-risk ethnic groups, including African American, Hispanic, Native American, Asian American, and Pacific Islander populations, who tend to have higher rates of type 2 diabetes, even at lower body weights. Screening typically involves a simple blood test, most commonly either a fasting blood glucose test, a hemoglobin A1C test, which reflects your average blood sugar over roughly the past 2 to 3 months, or an oral glucose tolerance test. These are quick, widely available, and can be done during a routine checkup. I also want to briefly touch on the difference between type 1 and type 2 diabetes, because the signs we've discussed can appear in both, though sometimes with different timelines. Type 1 diabetes tends to develop more rapidly, often over just days or weeks, and is more commonly diagnosed in children, teenagers, and young adults, though it can appear at any age. Because the onset is faster, the symptoms, especially excessive thirst, frequent urination, and unexplained weight loss, tend to be more pronounced and noticeable. Type 2 diabetes, on the other hand, usually develops gradually over months or even years, which is exactly why it can be so easy to miss. The body slowly becomes more resistant to insulin, and blood sugar creeps up little by little, allowing many of these 7 signs to develop so subtly that people simply adjust to feeling slightly off without recognizing it as anything unusual. Now let's talk about what you should actually do if you're recognizing some of these signs in yourself or someone you care about. The first step is simple. Don't panic, and don't try to self-diagnose based on a YouTube video, including this one. What this information should do is prompt you to have an informed conversation with a healthcare provider. Mention specifically which signs you've noticed and how long they've been going on. Doctors appreciate specific, detailed information much more than a vague sense that something feels off. If you have any of the risk factors we mentioned, bring those up too, even if you're not currently experiencing symptoms, because screening before symptoms appear is one of the most effective tools we have for catching prediabetes and type 2 diabetes early. And this matters immensely, because prediabetes is often reversible, or at least significantly manageable, through lifestyle changes like improved nutrition, regular physical activity, and modest weight loss if needed. Studies, including the well-known Diabetes Prevention Program research, have shown that lifestyle interventions can reduce the risk of progressing from prediabetes to type 2 diabetes by around 58% in some populations, which is a remarkably powerful statistic. This isn't about achieving perfection or dramatically overhauling your entire life overnight. It's about making sustainable changes that support your metabolic health over the long run. I also want to address something important, which is that having 1 or 2 of these signs occasionally doesn't automatically mean you have diabetes. Our bodies are complex, and symptoms like fatigue, thirst, or hunger can stem from dozens of other causes, including simple things like not drinking enough water, poor sleep, stress, certain medications, thyroid conditions, or other underlying health issues. The goal here isn't to have you convinced you have diabetes after watching this video. The goal is to help you recognize patterns worth discussing with a professional, rather than assumptions worth making on your own. Context matters, duration matters, and the combination of multiple signs matters far more than any single symptom in isolation. It's also worth mentioning that managing diabetes, if you are diagnosed, has come a remarkably long way. This isn't the same conversation it might have been decades ago. With proper management, including monitoring blood sugar, medication when necessary, nutrition adjustments, and regular physical activity, people with diabetes can and do live long, full, active lives. Early detection genuinely changes outcomes. It reduces the risk of the more serious complications associated with long-term uncontrolled blood sugar, including cardiovascular disease, kidney damage, nerve damage, and vision problems. So if anything, think of these 7 signs not as something to fear, but as an opportunity. Your body communicates with you constantly, and learning to listen to those signals rather than dismissing them is one of the most empowering things you can do for your long-term health. Let's do a quick recap of everything we covered, because repetition really does help this information stick. We talked about excessive thirst paired with frequent urination, which happens because your kidneys are working overtime to filter out excess glucose. We covered persistent fatigue caused by your cells being unable to access the energy they need despite having plenty of sugar available in the blood. We discussed blurred vision resulting from fluid shifts affecting the lens of your eye. We talked about slow healing wounds and frequent infections, tied to impaired circulation and weakened immune response. We covered tingling and numbness in the hands and feet, a sign of nerve damage that develops from prolonged elevated blood sugar. We discussed unexplained weight loss, which occurs when your body starts breaking down fat and muscle for fuel it can't get from glucose. And finally, we talked about increased hunger, your body's response to cells that feel starved despite adequate sugar in the bloodstream. None of these signs on their own are meant to alarm you, but together they paint a picture that's worth paying attention to and worth discussing with a healthcare provider, especially if you're noticing more than one of them or if you fall into a higher risk category. Diabetes doesn't develop overnight, and it doesn't have to catch you by surprise either. The information genuinely exists to catch it early, often before any serious complications ever have the chance to develop. But that only works if you're willing to listen to what your body is telling you and take that next step of getting checked. If you found this video helpful, do me a favor and hit that like button, because it genuinely helps this kind of evidence-based health information reach more people who need it. And if you haven't already, consider subscribing, because we cover topics just like this every single week, breaking down complex health information into something clear, practical, and useful for your everyday life. If you want to understand more about how blood sugar affects your body or what steps you can actually take to lower your risk of type 2 diabetes starting today, I've got another video that goes deep into exactly that, and I think you'll find it just as useful as this one. Take care of yourself, listen to what your body is telling you, and I'll see you in